Hey everyone, and welcome back to What the Hell? If you're tuning in for the first time, I'm Dr. Sarah Baxley, a mental health and primary care provider, telemedicine enthusiast, and your go to for breaking down all things health related in a way that actually makes sense. Today, we're going to tackle a big one, y'all: anxiety. You've probably heard people say, "Oh, I'm just anxious." But here's the thing: anxiety is more than just feeling nervous or stressed. It's complex, it's real, and it can impact your life in ways that you might not even realize. So let's break this down together. We're going to talk about what anxiety actually is, how it shows up in real life, treatment options like medications or therapy, and even some answers to some of those questions people are a little too embarrassed to talk about. And we're going to debunk some of the most common myths that I hear about anxiety. Does that sound all right? Word. Well, let's get into it. All right. So, first off, what exactly is anxiety? And here's the simplest way to think about it: anxiety is your body's alarm system. It's designed to protect you from danger. Back in the day, it helped our ancestors avoid getting eaten by saber-toothed tigers or something. Now, it's the thing that makes your heart race and your armpits drip before a big meeting. It's what keeps you up at night worrying about things you have no control over. But when that alarm system gets stuck in the on position, that's when anxiety becomes a problem. It's like your brain is yelling, "Danger, danger," even when you're perfectly safe. And that's what clinical anxiety is, y'all. And it's way more common than you may think. Roughly 1 in 5 adults deals with an anxiety disorder every single year. And here's the thing: anxiety doesn't always show up the way people expect. It's not just about feeling scared or worried. Sometimes it's this vague sense of dread that you just can't shake. Or maybe it's physical. Maybe your heart starts racing, your chest tightens up, or you get super nauseous. Anxiety can be sneaky like that, and it's different for everyone. For instance, my anxiety presents in a super weird physical way. Oh, I'm kind of embarrassed to admit this, but when I get super anxious, I get what's called the anxiety burps. And I think, yeah, you heard me right, burps. So I think it's because I almost like hyperventilate when I'm nervous and I suck in so much air that I spend the rest of the day burping super loud. It is so sexy for all you single men out there. Anyway, I digress. So, have you ever stayed up all night worrying about something like a presentation that was due at work or a tough conversation that you had to have and you keep playing it over and over on a loop in your brain? Or maybe you're up all night worrying about your kids. And then, of course, the next day, you go to tackle that thing you spent all night freaking out about, and everything goes fine. You didn't show up to your presentation naked. The person you had that tough conversation with was actually super receptive to it. And all of your kids called and told you how amazing their lives are. So you spent all night worrying about nothing. Does that sound familiar? Yeah, me too. One time I spent the entire night before this huge presentation I had to give at work, convinced that I would literally forget everything that I was supposed to say while I was out there. I even wrote up a backout script and wrote notes on my hand like I was in high school, which I didn't even need because the presentation went off without a hitch. The relief I felt afterward was just a reminder that my anxiety wasn't predicting reality. It was just being really fucking noisy. Anxiety loves to make mountains out of molehills, doesn't it? So, what does anxiety actually look like? Well, first of all, it's not a one size fits all thing. Some of the more common symptoms that you guys have probably heard about and experienced is constant worrying about things that you can't control. If you feel restless, irritable, or on edge all the time. Maybe you have trouble sleeping. Either you're up all night thinking or wake up way too early. And then there's those physical symptoms like a racing heart, sweating, or nausea. But here's what people don't always talk about: anxiety can also show up in less obvious ways. Maybe you're avoiding certain situations because they feel too overwhelming, or you're snapping at people like your kids and feeling off, but you just can't explain why. Maybe you're super tired all the time because, let's be honest, worrying 24/7 is exhausting. And let's talk about what anxiety is not. It is not being dramatic or weak. It's not something you could just snap out of. It is a real condition. And if you're dealing with it, You are not alone. Let's not forget that anxiety can look different depending on the situation. Social anxiety might show up when you're walking into a crowded room or even you're just thinking about making small talk at a party. Panic attacks, those are the ones that come out of nowhere and they feel like you're going to die, like you're having a heart attack. Whereas generalized anxiety might just be that low hum of worry that is always there, no matter where you are or what's going on. So now that we know what it can look like, let's talk about how anxiety is diagnosed. And this is where the DSM-5, or fancy speak, the Diagnostic and Statistical Manual of Mental Disorders. This is basically, guys, the playbook that we use for diagnosing mental health conditions. It set forth criteria to diagnose specific conditions. To get a diagnosis of an anxiety disorder, your doctor will look at things like, how long have you been experiencing these symptoms? Typically with anxiety, it's going to be 6 months or longer. And whether or not these symptoms are interfering with your daily life. Is it impacting how you function at work? Are you getting into more fights with your partner? Maybe there's another medical condition that could be causing them, like if your thyroid is all jacked up. So an example is that if you're worried all the time about everything and you can't seem to turn it off and there's no other physical explanation of it, that might be generalized anxiety disorder. If certain situations like public speaking or social events send you into a full-blown panic, that could be social anxiety. And if you're having these sudden, intense episodes of fear that feel like heart attacks and you're going to die, that's a panic disorder. And here's something important that I want you to hear very clearly. Getting diagnosed is not about slapping a label on you. It's about understanding what's going on so you can get the right kind of help. So let's talk about how anxiety impacts your life. And here's the thing about it, guys. It doesn't just live in your head. It impacts your relationships, your job, your physical health, everything. Maybe you're avoiding events because they feel too overwhelming, or you're so busy worrying about what could happen that you're missing out on what is actually happening around you. I remember a time when I skipped a dinner with some friends because I was just so freaked out that I was going to be awkward or say the wrong thing. So I didn't go. The next day, I was so upset that I missed out because they told me how awesome of a time they had, how great the food was. They laughed, they drank, and they caught up on all the gossip that I still didn't know. All the while, I was sitting at home by myself, feeling lonely and regretful, and worrying about shit that would probably never have happened in the first place. That moment taught me how much anxiety can rob you of connection if you let it. It is a thief of joy, plain and simple. Anxiety has a way of stealing your energy and focus, leaving you feeling drained and disconnected. And for the record, anxiety isn't just an adult problem. Kids and teens deal with it too. But it can look totally different for them, like physical complaints. They may say they have headaches or stomach aches, or if your kid starts acting out in school, maybe you need to have a conversation about if they're dealing with anxiety. What's even trickier is how anxiety can creep into areas you don't expect. It might affect your sleep, your appetite, or even your ability to concentrate at work and your sex life. It can cause your libido to decrease, not want you to be intimate with your partner. And let's not forget that chronic anxiety can take a toll on your body. It can cause you to have things like high blood pressure, gut issues, and my favorite, weight gain. Because when you're stressed and anxious, your body releases this chemical called cortisol, and that leads to excess weight gain. So, what the hell can we do about anxiety? First, let me say this. You don't have to do it alone. Anxiety is very treatable, and there is zero shame in asking for help. Some of the common treatments that we option at my practice are cognitive behavioral therapy, this or CBT. It's one of the most effective treatments for anxiety. It helps you identify and challenge negative thought patterns so they don't spiral out of control. Think of it as learning how to hit the pause button on your brain. So like if you immediately see red when somebody cuts you off in traffic, that's an automatic thought. And with CBT, we teach you how to pause, recognize the thought, and think of what's another way of looking at this. I once had a moment where my thoughts were, I was spiraling, y'all, over this upcoming wedding that I had to go to with my family. And my therapist suggested this specific CBT exercise. Write down the worst case scenario, the best case scenario, and the most likely outcome. And if you guys aren't already ahead of me, the most likely outcome was fine. And that's what happened. Just seeing it on paper, though, helped me breathe easier. I've personally tried CBT exercises myself, and I have to say that learning to reframe my thoughts has saved me from going down dark rabbit holes more times than I can count. Next up, I want to talk about medications. So I'm going to go over 4 different types of medications right now. The first one is called an SSRI. That stands for a selective serotonin reuptake inhibitor. That is nerd talk. But these medications are like your Zoloft or Lexapro. And these medications work by increasing serotonin levels in your brain. Serotonin, it's like your brain's natural mood stabilizer. And when it's low, your brain can get stuck in a cycle of worry. But by boosting serotonin, SSRIs help smooth out those anxious thoughts over time. But it's not an instant fix. You usually need a few weeks on this medication to notice the effects, but they are super effective for long-term anxiety management. Next up is everybody's favorite, benzodiazepines. These are medications like Xanax, Ativan, Valium, Klonopin, and these act quickly to calm you down during moments of intense anxiety or panic. And they do this by enhancing a brain chemical called GABA, which acts like a natural off switch for your stress response. But here's the catch. We really should only be using these for short-term use because they can be habit forming. If you have ever known someone who has been on Xanax for a long time and tried to come off it, they probably had a hell of a time because those withdrawals are intense. And side note, they are one of 2 withdrawals that can actually kill you, alcohol and benzos. So if you have been on Xanax for a long time and you want to get off of it, be sure to talk to your doctor about a proper tapering schedule so you get off of it slowly and safely. Next medication, back to the topic, is beta blockers. Beta blockers are actually a blood pressure medication, and one we like to use frequently is called propranolol. These are often used for specific anxiety situations, like people that deal with stage fright or public speaking fears. And they block the adrenaline rush that causes physical symptoms like your heart racing or shaky hands, and they help you feel more in control. For the record, beta blockers don't affect your thoughts, just your body's reaction to them. The last one I'm going to talk about today for medication is buspirone. This is another option for generalized anxiety disorder, and it works more subtly, though, by affecting serotonin and dopamine levels, which are your happy brain chemicals. And it helps to reduce worry without causing you sedation. So you're not going to get sleepy on buspirone. Now, it's not as fast-acting as Xanax or Valium, but it is a great option for ongoing anxiety, and it's not habit-forming, and you don't have to worry about dying if you withdraw. So another option is lifestyle changes. Things like, and you're going to kill me because this is so obvious, regular exercise, good sleep and diet, and cutting back on caffeine. Yes, you heard me. Those can all make such a big difference. I know everyone says that, but the reason they do is because it's true and it's worth trying. And sometimes you just need to talk to somebody who gets it. So if you can join a support group, hearing other people's stories can be really reassuring. This last one that I want to touch on is mindfulness and relaxation. Meditation, deep breathing, and yoga can help calm your racing mind. And I'll admit, just like you, I was skeptical about mindfulness at first. I mean, seriously, who has time to just breathe? But once I gave it an honest shot, it made a real difference. I started small. I was just doing 5 minutes of deep breathing in the morning. But I did notice that I started to feel calmer throughout the rest of my day. And now it's one of my go-to tools when my brain feels like it's on fire. It's about giving your brain a break. Moving on to one of my favorite and most hated topics is embarrassing questions and myths. So let's tackle some of those questions people are often too embarrassed or have been shamed into silence. One of the big ones is it normal to feel like I'm losing my mind? And yes, it is normal to feel that way with anxiety. You're not losing your mind. Your brain is just in overdrive, and you can get help. I remember once talking to a patient who was convinced that their anxiety meant that something was wrong with them. But seeing their relief after we had a discussion, when they understood what was happening, It was a powerful reminder that knowledge is a really powerful thing. This patient had been avoiding social situations, family events, thinking they were on the verge of a breakdown. After we talked about their symptoms and some practical steps they could use, like grounding exercises and starting a new SSRI, they came back 4 weeks later a different person. They said that they attended a family wedding, danced, and actually enjoyed it. And that was the moment that I lived for. That moment was everything for me and them. Another question that people get asked or people ask me, and I hate it so much, is will people think I'm weak if I take medication? What do you think? The answer is absolutely not. Managing your mental health is a strength, not a weakness. Medications are tools, guys. Just like glasses help you see, medications can help you manage your anxiety so you can go back to functioning in your normal life. Now I want to talk about a couple myths. And I'm not going to lie, I fucking hate when I hear people say these. The first one that just grinds on me is if a person is laughing or smiling, they don't have anxiety. Y'all, anxiety doesn't have a look. I've had patients tell me no one believes I'm struggling because I'm always joking around. Humor can often be a coping mechanism, but it doesn't mean that your anxiety isn't real or valid. Look at Robin Williams. That guy was so depressed and anxious, and he was a comedian. God rest his soul. And one patient shared how their jokes were just a mask for these daily panic attacks that they were having at work. And once they were able to speak about what was going on, it was the first time they told me that they had felt seen in years. Another one that is just grinds on my goat, I don't know if that's a saying, but I'm going to make it one, is that people with anxiety just want attention. This is one of the most harmful myths. I once had this teenager patient that I was seeing for anxiety tell me that they stopped talking to their friends about their feelings because someone dismissed it as drama. You're some drama. Anxiety isn't about seeking attention, guys. It is a struggle, and it is a real struggle. And if you can be heard and feel safe to express yourself, it can be fucking life-changing. So don't tell people that they just want attention if they're anxious. It's just not true. The last one that I want to talk about is that, and this is more like in a professional level, and this is where I typically see this is in the workplace, is that people with anxiety can't be successful or can't handle pressure. So you don't get assigned a big job, a big task at work because, oh, she's just too nervous. She's going to ask so many questions. I've seen countless people with anxiety absolutely crush their goals. In fact, some of the most successful, organized, and empathetic patients I have ever dealt with deal with anxiety on the reg. It's all about learning how to manage it. Anxiety doesn't define you. How you address it does. So here's the takeaway from today. Anxiety is real. Anxiety is common, and anxiety is treatable. Whether it's with therapy, medications, or lifestyle changes like putting down those fourth monster drinks, there's something that can work for you, and I can help you find it. Remember, asking for help isn't a sign of weakness. It is a sign of strength. It is a step toward feeling better. Next time on What the Health, we'll dive into the world of telemedicine, what it is, how it works, and why it's changing healthcare for the better. Until then, take care of yourselves. Stay curious, and remember, you've got this. Thanks for hanging out with me today. I'm Dr. Sarah Baxley, and this has been What the Health. See you next time.